Have you ever been told by a doctor at the clinic that you have sepsis or septicemia? This is a very common diagnosis that is made in the clinics, either in a public or a private hospital. And today I want to debunk the myth of this diagnosis, because most of the time, I would say over 90% of the time, it's not the correct diagnosis. So those attending to you at the clinic usually make a diagnosis of septicemia or sepsis based on a test called the full Haemogram test. I have a video which I did earlier on that. And what I want to say today is that a full Haemogram test alone is not enough to make a diagnosis of septicemia or sepsis. So what is septicemia? So the clue is in the suffix "emia", which is used in medicine to denote a value within your blood. So septicemia simply means that you have a high number of bacterial cells which are not supposed to be there in your blood. So typically your blood is supposed to be sterile without any foreign cells. But in this case, you have bacterial cells populating your blood. And it's not only bacteria, it could be other organisms. Like if it is viruses, it could be viremia. And this presence should be in a large quantity within your blood. So in most cases, this bacteria will come from a local infection. Maybe you have otitis media, which is an infection of the ear, or you have UTI, which is an infection of the urinary tract, or meningitis, which is an infection of the brain. And then this local infection is not able to be contained well by your immune cells, and they spread and enter your bloodstream, and they populate your bloodstream, especially if you are in a weak and vulnerable state. So without presence of bacteria within your blood in large quantities, then this diagnosis of septicemia does not hold water. And you have to remember that full Haemogram test will test even for localized infections that have not spread to become septicemia, because full Haemogram test tests for response to infection, does not test for the infection itself. So if you want to make a diagnosis of septicemia, then you have to do blood microscopy, that is doing a smear of your blood, staining it and looking at it under a microscope. Or what you can also do is blood culture test. So blood culture test simply means you take a small sample of your blood. If it contains bacteria in it, you grow that bacteria using a substrate. And after you have grown the bacteria, you'll be able to visibly see the presence of that bacteria within the substrate. And sometimes you also do sensitivity test to test whether that bacteria can easily respond to a group of antibiotics that we have in the hospital. So what about sepsis? So sepsis simply means that in a state of septicemia, your body has mounted a response. So in most cases, when bacteria is present in your blood, the body will launch an immune response by using immune cells such as phagocytes, and also using immune cytokines such as interleukins and tumor necrosis factor. The second response that it does is it increases the level of some molecules we call acute phase reactants. Just to mention a few, we have the C-reactive protein and procalcitonin. Although we have negative acute phase reactants which go down instead of going up, like transferrin, that is a molecule that is used to transfer iron. Your body will also release what we call radicals, or else free radicals. One of them being nitrous oxide. And this one increases the permeability of your blood vessels and also vasodilates. So it increases the dilatation of your blood vessels so that these immune cells can reach further and your blood can be able to permeate further. But all this response leads to terrible damage to your body, especially if it is done in excess. And this one now leads to a very severe diagnosis called septic shock. And septic shock simply means that your body has mounted such a severe response to having bacteria in the blood to a point whereby it is causing damage. And this damage will be in form of severe drop in blood pressure and organ failure. All this happens within a short time. So you can transition from septicemia to sepsis to septic shock within a short time. And septic shock is actually a life-threatening condition that needs HDU or ICU care to manage. So what's the point of this video? So the point of this video is to tell you that in most cases when someone writes that you have septicemia, you actually don't have it. And when you actually do have it, it's actually a life-threatening condition that can lead to septic shock. When you go to the clinic and a diagnosis is made, always ask yourself, is this diagnosis correct? But if you don't have enough expertise to tell whether the diagnosis is correct or not, then it's always good also to get a second opinion. Now you know. Thank you.